Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovelo, and I'm here with my most amazing facelifting, face fracturing, face reconstruction co-host, Dr. J. Calvert. How are you?
I'm good. I did do a face fracture yesterday. It was amazing.
I know, and you nailed it. I mean, like you actually literally nailed it.
I did literally nail it. I screwed it, actually.
Yeah, you did.
It was so great. I love doing face fractures. That's how I got good at doing facial aesthetic surgery. I was the guy that said, if you have a fracture in-house when I was at Pittsburgh, and back then airbags weren't a thing. And so face fractures were pretty common.
Big, yeah.
And I would just say I'd love to do it because I love taking the face apart to put it back together. It's kind of my thing.
Right. And then that transitions you into being an excellent facelift surgeon, which transitions us into this podcast, which is about the buzz that everyone's talking about, Kris Jenner's facelift. So this has been, I mean, if you haven't heard about her facelift, then you're like living under a rock because it's like everyone's talking about it. Maybe everyone in our world, maybe not everyone. But I feel like this story has been everywhere because she looks incredible. She looks like, as they all say, she looks like she's younger than Kim, her daughter.
She looks amazing. I think my comment to that is, it's only the surprise in everybody's voice that hurts because this is what good plastic surgery is, people.
Yes.
Like this has been going on in the background of all the poorly performed plastic surgery.
Right. That everyone's like, ooh, what did they do?
Right.
And no one talks about the really good facelifts that are done because people usually are a little more reticent to say they've had a facelift. So thank you, Kris Jenner, for going out and saying and being very honest that she had a facelift because exactly. This is why we do facelifts. This is why people get facelifts because they're powerful.
And they look great.
And they look great.
You do a great job. And your patient, you know, Kris Jenner named names. She said, I had it done. She had her last facelift like on camera when she had it with Garth Fisher.
Right. She's not
she's okay
shy
with it.
about it.
She is like, hey, this is part of looking great and doing my thing, which everybody should be that way. And the fact that she named names, you know, and called out her surgeon, who's Steve Levine in New York. Great. It's great. It's great for him. It's great for her. It's great for plastic surgery.
It's great for the public good.
Yes, because it goes back to our podcast a few episodes ago, is it okay to have plastic surgery? And the answer is yes.
Yes.
But I think that calling attention to good plastic surgery is awesome, and it should be called. Like, I have patients, like I've told the story many times, where there are patients of mine on the red carpet talking about their gown. And my hair was done by so-and-so. And my makeup was this. And the shoes were this. And blah, blah, blah. And then my pantyhose are like this. And they never say, oh, and by the way, the reason I look amazing, J. Calvert. They don't say that.
No, you'll never get that.
They don't. They will never. Yeah. Well, maybe they will now.
Maybe they will now.
Maybe they want to one-up Kris Jenner. You know who I'm talking to. And they may say, you know what? You're right. I should credit my plastic surgeon for making me look great because they should. It's true. And I'm inspired by their confidence, and I don't ask for that. And you don't ask for that. None of us do. And I'm sure Steve Levine doesn't ask for that because he does enough big-name celebrities. Like any of us who are any good at this, we do that. That's part of our deal. But the fact that Kris Jenner is like, you know what? It's okay to have plastic surgery. I did this, and this is my guy. Great.
Great. And I think we should say a few things about why her result has turned out as well as it has. So like we said, she is not shy about talking about plastic surgery, doing plastic surgery on her show. So I'm not exactly sure what number facelift this is for her. It's at least number 2 that we know of.
We know of.
There could have been more. We don't know. But this is what we say when we talk about facelifts. You start when you see the signs of aging and you never really look old. And when you go back and you retouch up the facelift, you will just keep looking better as you age. So if this had been her first facelift at this age and stage in her life, she would not have gotten this good of a result. She really wouldn't, because the skin would be more stretched out, it'd be more damaged, it wouldn't be as clean and tight a result. So this is someone who has done plastic surgery right over the ages.
Absolutely. And that's the thing, is you want to start when you see the signs of aging. And for some people, that's 38 years old. Some people, it's 44.
Right.
Some people, it's, whatever. But the reality is if you get good plastic surgery and it's done by people that are competent, You're going to look great. And it doesn't last forever, and that's why they get retouched up. That's why that's why you go back in and you do other things. You do lasers, you do Botox, you do, a little bit of fillers, fat grafting, all the things that...
The maintenance.
You have to have a great plastic surgeon who's going to say, no, you don't need that. Because the ones that say yes to everything, those people all start to metamorphosize into aliens. And I think they're trying to all meet each other so that they can get back on the spaceship that they came from and go home. But the reality is that with good plastic surgery, it's not noticeable. And I think that it's great that Kris Jenner has, said, yeah, oh, look at this. And here's who did it. And I'm so happy. And they did a great job. That's amazing.
It's noticeable in the fact that, like, no one that age looks that good.
Yeah.
So it's like, did she have a facelift? I wonder. No one of that age looks like that unless they've had some good plastic surgery.
No, I just did a rhinoplasty and breast augmentation with a lift today on a patient. I'd done her facelift 3 months ago. And she came in, and my nurse was like, boy, she really looks great. She how old is she? She's like 40, 41. I was like, well, 61, but what's the big deal? And it was like, oh my God. Like I said, well, I just did her facelift like 3 or 4 months ago. Now she's doing the nose and the breast. She's like doing like a big overhaul. But the fact that she looks 20 years younger than she does based on just a plastic surgery nurse evaluating her face says everything. And of course, she's over the moon. She's thrilled. She's like, I don't understand. Like, why isn't everybody doing this? Well, I think they are. And that's the take-home message is I think for whatever reason, facelifts have made a comeback. And I think it's because of filler face. I think the filler look has caught, and the thread lift, debacle.
The puffy pumpkin faces. Like, that was having a moment for a while in the early mid-2000s.
Not with me.
And people were like realizing how strange that looked. Everyone was trying to avoid the facelift. Yeah. So they were like putting all this crap in their face. And people didn't look better. They just looked weird. And they looked like they were older trying to look younger. So I think that perhaps you're right. We're seeing a swing back to the facelifts because people realize that that's what works.
Yeah, it works. And it does look great. And, look, they're not benign operations. There are problems with these operations like any surgery. And we always talk about complications, the acute complications of, some nerve injuries that can be, temporary, some neuropraxias, bleeding, hematoma, those kind of things. But then also, like, sometimes the aging isn't awesome. You have to do things about that. Lasers, Botox, fillers, some fat grafting, all those things come up as the maintenance of the facelift. So yeah, once you go down the vein of I'm going to have a facelift, well, you have to kind of sign up for that
for the commitment
and work with your plastic surgeon. These things aren't cheap, so you have to have the money to do it. You have to have the time to do it, and you have to have the desire to do it, and you need to pick a plastic surgeon that you can work with over time.
Yeah, 1,000%. But I do want to, let's focus a little bit on the specifics of Kris Jenner's facelift. We have to call out like the giant elephant in the room, which is that her after photo, as great as it looks, is so photoshopped. I can't even.
Yeah, no, they're all photoshopped. All these photos are. There's no way.
Yeah. We know this about the Kardashians. They are known for only sort of releasing the best versions of themselves, which usually are a little photoshopped. And here's the thing about facelifts. A facelift is designed to sort of redistribute, relift the architecture of the face, the foundation of the face, and redraping the surface of the face. It does not treat the skin. It does not treat the fine lines. It does not treat the wrinkles. It does not treat the skin damage. That's not what a facelift does. Other things do that, lasers and things like that. But this beautiful, flawless, lineless skin that you're seeing in the after photo, that's not from the facelift.
No, I mean...
That's from some rearrangement of pixels.
Okay, so... just for the public, because I had a patient who I did the daughter's nose, and she was like, she looks so amazing. Her skin is flawless. It looks so magnificent. It's perfectly this. It's perfect. I go, it's not that way. It doesn't look that way. It's okay everybody can present themselves however they want to. These are not medical grade photos. These are for the public, photos. So it's the presentation of themselves
As
the
they
way
want
they would like
to be
seen.
It's not the medical grade on a blue screen before and after true results.
Right. And evidently I'm the only guy that's willing to do that, and you're the only girl that's willing to do that. But, the reality is that the architecture has changed. You can't Photoshop the architecture of the face. And her operation was done very well. She looks great. You can look like this. You can do this. If you have money and you have time and you're willing to heal and you've been doing it all along, then you can look like this at these ages. And
maybe not like that.
Maybe not like that.
Maybe not like that.
But something like that. I
mean,
think
the skin, I'm sorry, the skin is just so perfect. And also what really helps these before and afters is she's definitely changed her hairstyle to a little bit more of a youthful hairstyle, which I think also contributes to like the dramatic befores and afters we're seeing. But I want to call out that if she had the skin in that after photo that she probably actually has in this photo with some of the fine lines and the texture that you're going to see in someone of that age,
which is
the
totally
result
normal
would
because
not be
you're at that age.
Right. Totally normal. The results would not be as dramatic as they are portrayed to be. Not to say she didn't have a great facelift, but I just want a little bit of a reality check thrown into that.
Yeah, and it's okay. When you look on my Instagram and my website, and this is, I can speak for me only, those are not Photoshopped photos. They are like, I took the picture and now it's on the website.
Right.
And as I've told this story before, I had a UK attorney who had a facelift with a big name guy in New York that didn't go well, and he grabbed some tool to look at which before and afters have been photoshopped, and he said, "Congratulations, you're the only guy of the people that I'm looking at to correct my facelift who didn't Photoshop their before and afters on their website or Instagram." And I said, "Well, do other people do it?" He goes, "Not do other people do it. They all do it.
Wow.
Everyone. Every single one." And he goes, "They're all filtered. They're all Photoshopped. They're all altered. And it's so easy to tell." So that's the thing, is that it's like when you are the consumer looking at these before and after photos, you must grab yourself a very large grain of salt to take it with you for the viewing. You must, you need to put a backpack on with a grain of salt and say, I'm going to look at this with a grain of salt, because in most cases, you're looking at something that isn't exactly the way that it should be in real life. With that said, when people come to my office, I just say, well, go sit in my waiting room and look at the results, because like they're there, and
right,
and let me show you, these people I've done surgery on the office, and you can figure it out. Because real life is how you want it to look. You want it to look great. So the good news for and Kris Jenner's, she's I commend her so much for talking about it and for saying, I've done this and done that. But in terms of those of you that are like, well, how do I look at this? Well, look at it, through the lens of like, all right, this is a media photo. It's not a before and after that's on a website. And, what's on websites? Well, maybe they're also a little bit touched up or not. I don't know. It depends on the surgeon. And every surgeon can, talk about that for themselves. I don't do that. I take the pictures and I put them up on the website and read it and weep. And that has cost me, because a lot of people say like, oh, but the skin and this and that. And I was like, well, I'm not willing to smooth that out. That's not for me. We just called that out on a photo we found on a breast before and after, where the incision, the scar was gone
on one side.
On one side. Like, it was like, dude, this is the worst Photoshop job ever. And by the way, you should have done it on the other versions of that photo. So it is hard for the public when evaluating, which is why you go to people that have great reputations. You've gotten a referral, you've seen their work, and you're going to a great place. Right.
And I think we can probably show, so we have another photo that we can show of a celebrity who also had a facelift, but he does not Photoshop his photos. He goes out there and whatever you take, you take. And I think that is a good representation of what a true before and after would look like in a real person. So we have the lovely and very attractive Brad Pitt. So this one, the before and after is unfortunately reversed. The before is on the right side as you're looking at it, actors on the left. But like, you can still see his fine lines are still there. He still has some, crow's feet and some lines around his mouth. Like, he hasn't photoshopped that. And so I think that is a good, more or less representative result of what a facelift in a man should look like.
Yeah, I mean, that's what you want. You want a clean jawline. You get the skin sort of redistributed. It's not overdone. That's a great facelift, and that's, for men are a little different than women when it comes to the results that A, they want, and B, that look good.
Right. You don't want a super pulled, tight, defined neck and jaw in a man or elevated eyebrows that starts to look a little strange. You want to maintain some of that more rugged appearance. And I think, Brad Pitt got an excellent result there. And I think his photos are great. So,
I'll tell you a quick story about
salt.
that. I did a facelift on one of my buddies who is a massively successful entrepreneur. And he looked fantastic. He looked like my fraternity brother, and he's in his 70s. And he looked great. He looked like he was, like it was probably when I was like 45, 46 years old. And he looked awesome, like so good. He's a handsome guy. He looked great, but he said, "Can't you pull this any tighter?" He's like, "I want this tight. I want it to look like it doesn't look smooth and it doesn't look like it's tight." And I was like, "No, because you look normal." I said, "I can do that. I can physically do that. I can surgically do that. But you're going to look weird. Like you don't want to look weird." So I said, "No, I'm not doing it." He goes, "I'll pay you." He's like, "I have tons of money." I was like, "I don't care. Like, I don't want your money. I want you to look awesome. You look awesome." He disappears. He's pissed. He's angry with me. About 2 years later, one of my doctor buddies who works at one of the hospitals where he happens to hang out comes up to me and goes, "Hey, did you do that to so-and-so?" I go, "Oh, no." I go, "What?" It's like, "Man, does he look weird. He looks like a bug." I was like, "No, I didn't do that." I go, "You must have gone to somebody that was willing to do it." Because if you have enough money, this is like the
Someone
Michael
will do
Jackson
it,
story,
yeah.
right? If you have enough money and you push and you flash that, people will do things because the money's there.
Right.
And so sure enough, he said, my friend said he looked bizarre, looked like a bug, looked like an insect. Terrible facelift. I said, I didn't do that. In fact, I told him not to do anything else. But,
To each their own.
he wants it.
Yeah. But yeah, that's where, in the men, we usually try to underdo it.
Please.
A little bit.
If you're doing mine, which
Yeah.
you will be,
We'll
underdo
underdo
it, please.
Just going for a B here.
Right. Let's quote
As
Terry
Dr. Dubrow.
That's right. Just get a B. That's all I want. Like, don't overdo this. I don't need an A. Just get a B. It's a great lesson.
Yeah.
And consequently, that's why Terry looks totally normal and totally, nobody's like, "What happened to Terry's nose?" Nobody's saying that.
Right. Right. I think the last celebrity we're going to go through today, we've already done a whole podcast about the lovely and amazing Lindsey Lohan. But I just wanted to bring her back for a hot minute because she said something recently that just I thought was so funny because I joke about this all the time when patients deny having facelifts. And full disclosure, I have no idea if she had a facelift or not. We all know she looks
may not,
amazing. I don't know exactly what she did. But my joke is always that especially when patients have had facelifts, they always like to credit, as you say, their creams or like the alkaline water or the yoga retreat they went to for why they look so amazing. And she recently said something very similar where she was like, "Oh, no, I just drink green juice and chia seeds." I do some
Water with chia seeds.
Water with chia seeds. And I was like, oh, girl, she did not just go down that road.
She did.
She did. But then she also owned up and said she does the Botox and a little bit of fillers, and she loves the lasers, which is going to give her the great skin. So I have no idea what Lindsey Lohan does. We all know she looks amazing, but I just love that she put that out into the universe that she's so flawless because she drinks green juice and eats chia seeds. If only it was that simple.
It is amazing. But again, everybody just needs to listen to it's okay to have plastic surgery.
It's okay.
It is. It's okay to have plastic surgery. You can own up to it.
I mean, granted, we're biased, but still.
But
It's okay.
we're here to it's, you're not robbing a bank. You're not selling drugs to children. You're just having plastic surgery to feel better about how you look for yourself. Period. End of story.
Right.
There's nothing else to it. It's not.
There's no deep meaning.
No, it's just like, it's like why you go to the gym. Like I've put on a few pounds. I'm going to eat better and work out harder and like slim myself down.
Right.
My face is getting saggy, but I'm going to go get a facelift and I'm going to look great.
And you're going to look great.
It's okay.
It's okay. It's not that deep, as my teenage son says.
It's not
that deep.
And with that said, there's also the side of it that's like, not only should you be okay with it, but you should be okay like asking questions about it. You should be okay like investigating, like doing what we're talking about, which is, all right, well, if these people do look great, what did they do?
Yeah.
And talking to a board certified plastic surgeon about how do you achieve those looks?
What
How
are
do you
my
do that for
options?
yourself?
Yeah.
There's plenty of options. You can bring a budget. You can say this is what it costs. You can. I have this much money. I mean, I don't have any problem talking to patients about what those budgetary aspects are because this stuff is not cheap. We say it all the time, but the reality is that it is worth a lot to you when you look great.
I couldn't agree more. And again, thank you to Kris Jenner for putting herself out there and bringing plastic surgery to the world. And with that in mind, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.